Hello and welcome back to another episode of PodcastDX. I'm Lita.
And I'm Jean Marie. Ron will not be with us today, and today we are talking about something that affects millions of people every year, but doesn't always get the attention it deserves: fall prevention, especially for older adults.
That's correct. Falls are the leading cause of injury among people aged 65 and older, and they can lead to a cascade of health problems, from broken bones to loss of independence. But the good news is many falls are preventable, and there's a lot, put a comma there, Lita, and there's a lot people can do to lower their risk.
When we talk about falls with older individuals, we're not just talking about scraped knees or bruises. The consequences of falls at an advanced age can be life-changing.
That's right. Hip fractures, for instance, or head injuries, or even something as simple as a wrist fracture could mean a long hospital stay, rehabilitation, and for some, never fully recovering to their previous level of activity. The CDC reports that 1 out of every 4 people over 65 fall each year, but less than half of those tell their doctor.
Yikes. And after a fall, even if there's no serious injuries, the fear of falling again can set in. And that fear can make people less active, which weakens muscles and balance over time. And that ironically increases the risk of additional falls.
Right. So they think they're being safe, but they're actually making themselves weaker or less balanced, and they might be more apt to fall again.
Right.
So what puts someone at a higher risk? Well, there are personal factors, things like muscle weakness, balance problems, vision or hearing loss, certain medications, and chronic health conditions like arthritis or diabetes.
And there are also environmental factors. It's really important if you're older and as you age, your vision changes. So you need to have increased lighting, because poor lighting is a problem. Having clutter in an area so that you don't have a clear walkway or clear areas to hold on. Loose rugs are a huge issue, and throw rugs are problematic. And then stairs without railings or grab bars that you can actually hold on to and give you support. And even pets can be problematic if they like to get underfoot.
Right. And sometimes it's a combination.
Sure.
For example, a person with slightly poor balance who is also wearing slippery socks on a hardwood floor.
Or someone with slightly poor balance who's wearing long pajamas that trip them while they're trying to do multiple things at the same time.
I've heard of that.
Mom.
Happening.
Yeah. Medications can also be an issue. Blood pressure medications, sedatives, antidepressants, or anything that can cause dizziness can increase one's risk of fall.
And it's important for older adults to have their medications reviewed regularly by their healthcare provider to make sure that nothing is unnecessarily increasing that risk. Sometimes adjusting the dose or switching to a different drug or even switching to a different time of day that they take the drugs can make a huge difference.
One of the most effective tools for preventing falls is actually exercise, specifically exercises that build strength and improve balance.
Things like Tai Chi or gentle yoga or resistance training.
Or a combination of all three.
Even a simple chair exercise can help. The stronger the muscles in your legs and your core, the more stable you are. And when we say core, we mean the abdomen and lower back. Right.
Well, yeah, your whole middle section.
The middle section.
And balance exercises like standing on one foot, walking heel to toe, these can retrain the body to respond better if you do trip or slip or slightly lose your balance.
Well, okay, it's your turn.
Yeah, we've talked about strength. But like I said, balance is just as vital. And you can have strong legs, but if you lack balance, then a simple shift in weight can send you tumbling.
Well, balance is really about communication between your brain, your eyes, your inner ear, and your muscles. As we age, that communication can slow down, especially if we've been less active or have vision, hearing, or neurological changes.
The great news is balance can be trained and improved at any age. And you don't need a fancy gym to do this. In fact, you can do balance exercises right in your living room. And I would say, like, you consult your healthcare provider, and they can maybe recommend or prescribe physical therapy. And then the physical therapist can give you exercises and run through them that are specifically tailored for you and your needs.
Right. And if you use a walker or if you just feel unsteady, it's important to make balance training safe. The last thing you want to do is practice preventing falls and actually cause one.
Sure. And one easy approach is to stand behind a sturdy chair, one that doesn't have wheels, and place your hands lightly on the backrest, and then you're not leaning on it heavily, just using it for reassurance to catch yourself if you need it. And once again, your physical therapist can show you how to properly and safely do balance and muscle building exercises.
If you have a walker, you could stand between its handles and use it for the same purpose.
Yeah, ask your physical therapist about that too.
Make sure that the brakes are locked if it's a rollator.
Oh, yeah, jeez. And some simple balance exercises you can do at home. As we said, there's the heel toe is one that's often recommended, and you stand tall, you hold your chair or your walker for light support, and then you place one foot directly in front of the other so your heel touches the toes of your back foot, and you hold that for 10 to 20 seconds, and then you switch feet. This is something that I am unable to do. I fall over.
Oh, well, yeah. I guess you got to practice a little
bit.
I
need to practice more.
Carefully.
Yep.
There's also mini side leg lifts. If you hold the chair, also standing at the back, and you slowly lift one leg out to the side a few inches, keeping your toes pointed forward, and then you lower it slowly. You repeat that 10 times per leg, and it strengthens your hip muscles, which are key for lateral stability.
And they also might recommend that you march in place, or that you slightly shift your weight from side to side, or that you practice sitting and then standing. And all of these things, it's great to build both muscle strength and stability and balance.
Well, the key is to have slow, controlled movements. Don't rush. And if you feel wobbly, that's exactly what the support is for if you're using a heavy chair or a walker that's locked in. And
I know a lot of retirement facilities have chair yoga and chair exercises, chair cardio. And then there's also programs like Silver Sneakers. And they actually have online YouTube, for example, videos for people who want to try to exercise at home. And they have chair yoga and chair cardio exercise with that as well. Yep. And then you might want to check out your local gym or your local park district and see what classes they have available.
Right. And if you have significant balance issues, it's a good idea to work with a physical therapist, like Jean was saying.
Yeah.
They can tailor a program specifically for you, making sure it's both safe and effective.
And it might sound unrelated, but good vision and hearing are essential for fall prevention. If you can't see a hazard or hear a warning, like someone calling out, "Watch your step," you're at a higher risk.
Exactly. Regular eye exams to check for cataracts, glaucoma, or the need for updated glasses are important. And hearing tests can help identify if hearing aids might make a difference.
And let's talk about practical home safety changes. This is one of the easiest ways to reduce your risk of fall.
Go ahead.
I would say start with lighting, and that's something we actually have done here. We've integrated lighting that comes on automatically at dusk and turns off at dawn. And you want to make sure that it's enough light so that you can see clearly, especially at night. And then we also have motion-activated sensor night lights in the hallways and bathrooms, and lights that don't disturb your sleep. They're set underneath furniture, but they light up pathways at nighttime.
And speaking of pathways, you need to make sure that your pathways are clear by removing clutter, securing loose rugs with non-slip backing, and making sure cords are out of the way.
Oh, that's a very good tip. Handrails on both sides of stairways are important. Grab bars in the bathroom, especially near the toilet and inside the shower area, and shower chairs as well. And then non-slip mats in the tub are a great way to help prevent falls.
Yes. Your shoes should fit well and have non-slip soles.
Oh, good, yeah.
Avoid high heels, floppy slippers, or socks without a grip.
That's, all really good advice. We have our like Pilates socks with the grippers on the bottom. Some people think that going barefoot in the house is safer, but if the floor is slippery, it can actually increase your risk of fall, especially if you have less sensation in your feet due to conditions that affect the nerves like diabetes or the blood flow that, affects your sensation in your feet.
Right. We also have technology now that can help.
Yes.
They have wearable devices that will detect a fall and alert someone. A smart home system that can turn on lights automatically. Even voice-activated assistants, so you don't have to rush across the room to answer the phone.
That's great advice. And medical alert systems, those that, like you may have, we might be dating ourselves, but they used to have the help, I've fallen and I can't get up type buttons, can make sure that help arrives quickly if a fall does occur. I know we use our Apple Watches that detect falls, but there are a number of smart wearable devices that can detect falls.
Yes. Fear of falling can be paralyzing both mentally and physically, but there are programs specifically designed to help older adults to rebuild their confidence.
And for example, the Matter of Balance program combines exercises with education on how to move more safely and handle falls if they do happen, how to fall safely, which is not something that you normally think about.
Right. If a fall does happen, it's important to report it to a healthcare provider. Even if you think you're fine, there may be underlying injuries or underlying causes that made you fall.
Yeah.
Like a sudden drop in blood pressure that needs to be addressed.
And if you live alone, have a plan for how you will get help if you can't get up. That might be a cell phone you carry in your pocket, an emergency call system. There's the home smart devices that you can actually ask them to contact someone, so you just need to verbally do that no matter where you are and what happens.
Well, falls are not an inevitable part of aging. With the right combination of personal health maintenance, home safety, and awareness, many falls can be prevented. Maybe we can get it below that 1 out of every 4.
Yes, hopefully. And Lita will make up for that. It's about being proactive. Small changes now can make a huge difference in independence and quality of life later. And just to remember, this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Thanks for listening to this episode of PodcastDX. Take care of yourselves and the people you love. And remember, staying steady is a lifetime skill.